Hi, I'm Dr. Steve Myers, and I'm here with my patient Richard, who is 3 months out from a stem cell procedure to treat his left shoulder arthritis and right knee arthritis. Before we talk to him, we're going to take a quick look at his imaging studies.
Okay, so taking a look at his x-rays of his right knee, zooming in on the inside of the right knee here, he's got good joint space between the bones, but he does have a developing bone spur on the inside of his right knee. And on the side view of that right knee again, he has a bone spur developing on the back of the kneecap right here, and some thinning of the space back behind the kneecap. Looking at his left shoulder, this straight-on view of the shoulder, you can see significant arthritic change with large bone spurs coming off the bottom of the joint on this left-hand view here, thinning of the space between the scapula and the humerus, and all these metal fragments from his prior surgery where the wires actually have broken over time. On this view from this is a straight down view looking through the shoulder. He has multiple bone fragments from his prior fracture dislocation which never healed, and significant loss of joint space in the shoulder joint.
Okay, so thinking back to before your stem cell procedure 3 months ago, describe your symptoms. Let's start with your shoulder. Describe your symptoms in your shoulder. What kind of issues were you having with your shoulder joint?
Well, the pain was off the chart. It was 10 plus. And the arthritis pain was bad due to the fact that after having this incident 17 years ago and having
The dislocation of the shoulder.
dislocation, and they bolted it back together. And it's been in serious pain, severe pain, for 17 years.
What activities were especially difficult with your shoulder?
I couldn't do anything. I mean, it was to the point where if I moved it any amount, it was awfully painful to do anything.
So getting dressed, shampooing your hair.
I could shampoo my hair, get dressed, but I was constantly in pain.
And let's switch gears. Let's talk about your knee. Thinking about your knee symptoms, that right knee, what kind of issues were you having before treatment?
Before treatment, I could be driving down the road and be in the car for about 45 minutes, and I could have to get out of the car and walk around the car and stretch my knee because the pain was so severe I couldn't walk.
How did you come to the decision of doing stem cell for your treatment?
Well, my wife's a person who looks at all the opportunities and whatever has to be done to try to get me out of this pain. So we heard your name through a friend, and we came immediately, and we have been totally satisfied. I have, and she is too.
So here we are 3 months from procedure. How's the shoulder doing?
The shoulder right now has no pain, zero pain. Now, it might have some pain if I was to go out and do something crazy, but no, just normal living and everything, I have no pain.
So normal activities throughout the day,
No.
shoulder doesn't hurt anymore.
No,
And the knee, how's the knee doing?
the knee is great. I'm more excited about the knee than I am the shoulder, but the knee has no pain.
Able to drive, doesn't bother you.
Does not bother me at all.
So with the shoulder, comparing now to before, 10%, 50%, 80, 100% better compared to before we got started?
They're both, the knee and the shoulder, are 100% better. I mean, it's unreal. And I'd recommend this to anybody. I'm serious.
Well, thanks so much for coming in and letting us know how you're doing.
Oh yeah, thank you. You bet.